Welcome, ladies and gentlemen, to the Second Floor Podcast. My name is Kenny Buller, and I am your co-host. On today's episode, we bring to you not one, but two physiotherapists who absolutely love what they do and are huge advocates for health and wellness when it comes to both general population clientele as well as athletes. And why I'm so excited to bring them both on today is because not only from the perspective of Raj Dillon being, a friend of mine, a brother of mine, a mentor as well, he brings a wide array of knowledge from the space of physiotherapy. He's the founder of Pivotal Physio here in Edmonton, Alberta. As well, he brings on a fellow colleague of his and someone who also is extremely passionate in physio, and her name is Kaitlin Phillips, all the way from the East Coast. So we welcome Kaitlin all the way from the Greater Toronto area. Both Raj and myself and Kaitlin connected in this episode in a way where we got to talk about the importance around the consultation of meeting with a client. And I got to pick their brain a little bit on what are the most important questions that you absolutely need to ask when you're starting your journey in helping out your client. We also, for everybody out there, not only fitness professionals, we also got to go deep into the 6-phase warm-up from Dr. John Russon himself in the pain-free performance specialist certification that I've recently completed, but also just from the perspective of how both physiotherapists, Raj and Kaitlin, work this through with their clients every single time they work with them. And we talk about the importance as to why you, when you warm up in your workouts, need to be doing this quick 12-minute 6-phase warm-up. With everything else in between, we talk about the importance of physiotherapy, as well as almost like looking at it where if you have a car mechanic for your vehicle and you're getting your regular checkups, why are you not doing that for your own body? And we look at comparing that to a physiotherapist being that car mechanic for you when it comes to fine-tuning your body and going from being able to move effectively to being able to perform efficiently and effectively. So pretty excited to bring on both physiotherapists, Kaitlin virtually, and of course Raj at this time while the city was open. We were social distanced and masked up. So we are hoping you enjoy this episode. Please like, subscribe, share, check us out on iTunes, Apple Podcasts, Spotify, as well as YouTube. And last but certainly not least, TELUS Optic TV here in Western Canada. So thank you guys. We appreciate you tuning in, and let's dive in. I would like to first of all thank both of you for, giving your guys' undivided attention and time. I know this setup is not a normal setup. Currently, we have Kaitlin out in Toronto in Eastern Pacific time. Really respect the fact that you're out here to give us knowledge, give us a deeper understanding with Raj Dillon, who happens to be a very regular guest we like to have on the show. He's a good friend of mine. He's a mentor. He's a brother. And so to have both of you guys in the same space of being knowledgeable in physiotherapy is going to allow for us three to explore a conversation, guys, around, what a good warm-up looks like, what a good physiotherapist looks like, the importance of having a physiotherapist on your team. And when a lot of athletes or when a lot of general population niches out there, for anyone who just needs to make sure they discover maintenance and want to know what that looks like, we're going to basically have a conversation today around the importance of having a physiotherapist by your side all the way through. So thanks to both of you for taking the time to be here. I'd like us to very much so make it round table. Whoever wants to begin, I'd love to, throughout every question I ask and whatever dialogue we bring, both of you feel free to share. And if we could start this conversation off with, from your opinion, what exactly is a physiotherapist? Like, how would you define who a physiotherapist is now going into 2021?
Thanks for having us. First off, Kenny. I'll just say one of the things I would kind of use to describe a physio is a facilitator of optimal performance or optimal movement. I think that our job is to not like do everything for someone, but rather give them the tools to be able to take care of themselves. Ultimately, I think it's kind of like I said, providing those tools for someone. Raj, anything to add to that?
No, Kaitlin. Again, Kenny, thanks for having me on again. And Kaitlin, thanks for joining us today, all the way from Toronto, from the 6. I agree with you that the physios, in my definition, are movement specialists. So we tend to have a skill set of evaluating human movement, evaluating potential human movement dysfunction, and then, like Kaitlin said, offer interventions along that spectrum to help that person move better and ultimately perform better.
And when you look at where both of you come from, how much of your own background revolved around being involved in sport has helped you progress yourself in working with athletes specifically? I find that, there's a lot of things I personally am able to adapt to quicker because of my athletic background. And I'm just wondering, for both of you being very, fit individuals who like to experience different levels of sport. I know for you, Kaitlin, you have a varsity background in soccer. And I'm just wondering how much that has led to you just being able to understand athletes better and having that experience in working with athletes as a physiotherapist.
Yeah, totally. I think having that background gives you a little bit better of understanding for kind of like what it takes to be an elite level athlete and kind of what it takes to maintain that optimal performance, make sure you're moving well, make sure that you're kind of like in a state to prevent injuries as well. So I think having like that background really helps overall, just with the understanding of the human body in the athlete side of things. Yeah.
I would add to that, Kenny, that the background certainly helps because as much as possible, the things that I ask my patients to do or the tools that I use to treat my patients are things that I try to have done myself as well. It isn't always possible, but as much as possible, I try to make sure that that's the case.
Yeah, it's really interesting both you guys say that, because there's something myself as a trainer I always like to tell, specifically athletes. I know it's a very different world depending on progression and how fast or slow you're moving someone who doesn't necessarily have as much athletic experience. But one of my favorite things to say is there's nothing I'm going to make you do that I personally haven't done. And I find that's the beauty of experimentation. And recognizing that if you're about to show someone something that is physically very demanding, you have to ask yourself if you've tried it in the past or if you're personally doing it yourself. And I'm just wondering what that art of experimentation looks like for both of you throughout your practice. If both of you find that it's a lot of reading or a lot of self-experimentation, or if it's, however way you like to explore different things you've tried, what are some of the things you need to check off the box to make you determine whether or not you will show that to a potential client who is an athlete?
Yeah, I think that you are kind of bang on with you don't really want to be like asking something of someone if you don't understand it or are unable to do it yourself, right? So I think it's important, like you have to understand like how someone should be moving. So if you're demonstrating something and you don't know how to do it, it makes it very challenging to kind of know if that person's doing what they should be doing with proper form or doing it correctly. So I think it's important. And I think Raj and I kind of both come from that athletic background. We love to continue to like train and work out. So we're always kind of keeping our like repertoire and everything up to date. And just knowing like different things that we should be kind of giving to people, and just able to like correct them as well if they are doing something with poor form or that kind of thing.
Mm-hmm.
One of the other things that, going back to your question, Kenny, about like how we make decisions about what to prescribe to people, it does boil down to the initial movement analysis. If they demonstrate capacity to move in a certain range of motion or perform a certain capacity of work, then we know that it's safe to work in that zone, so to speak. Whereas if they show a deficit in a certain range or a deficit in a certain capacity, then we know that's where the stimulus has to be imposed to create an adaptation.
And I'm really glad you guys mentioned that, because that's the fundamental assessment a physiotherapist, or I find any trainer, would want to do on someone. It's funny how we can almost just expect someone knows how to move a certain way, especially when they come in with the dialogue of, hey, you know what, I've been training for like 5 years now. I'm just off season. I just need to do some maintenance, and they're sort of prescribing to you what you need to do for them. Mm-hmm. And at first hand, I find this was beautiful when I worked day one with Raj myself to experience what that looks like at Pivotal Physio. I got to actually see that even with that dialogue I brought to the table when I was preparing for competition, Raj put me through an assessment that I find you would almost put through anyone, whether they're an athlete or not. So you could kind of see exactly, okay, here's what you're saying, but now here's what I'm seeing. That's right. And then being able to kind of bridge the gap in between. Now, with athletes, there's that whole phase of digression sometimes, whether they have an injury or whether you notice certain things that you got to improve upon, right? Especially when it comes to some of the pillars that you were about to mention, Raj. How do you have that conversation with an athlete when you need to kind of let them know that things are about to slow down? And if you've ever had a time where you needed to do that, and sharing what that experience was like, and how that conversation, like how important that conversation needs to be, even if it's at the detriment of, hey, I don't think we should even have you be game ready in 4 weeks. I feel like we should consider looking at other options based off of this deficit that we see. It'd be interesting to hear from both of your guys' experiences, like what that conversation looks like with an athlete and why it's so important, so you could set them up for success and not failure.
Mm-hmm. Want to lead, Kaitlin?
Yeah, for sure. So I think it's important to have kind of that clear line of communication. So from the get-go, it's important to know that there are going to be times of regression. There are going to be times where maybe the plan for like return to sport changes a little bit. So not everything with the rehab setting is predictable. So there are going to be times where you have to have those difficult conversations. Maybe an athlete's supposed to, like you said, return to competition, let's say 4 weeks, and things aren't looking as good as they should be for that plan that you had in mind previously. So it's basically just kind of having that conversation, like sometimes things like this can happen. You want to make sure that you do it in a way and you're presenting it in a way that doesn't kind of like, I guess, ruin their spirits, so to speak. So you want to make sure you're basically still allowing them to have like that motivation to continue, and just make sure that they know like the end is coming where they're going to return to sport, but hey, we might have to change the plan a little bit right now to allow for you to do that in a better way, I guess. You don't want to have someone returning too soon and then having even more of a regression. So yeah, I think it's important, like I said, just kind of from the start, have that clear line of communication, earn their trust, so that everything that you kind of tell them, they know that it's coming from a good place, and you want the best for them, kind of thing.
Yeah, it's important to actually like sit down and have that conversation. I find that when you're getting them geared up for that change, what exactly does that change look like, Kaitlin? Like what are the significant things that change? Is it, a lot more stretch therapy you're focusing on with them? Is it you telling them, listen, the practices that you're going to right now, let's replace it with more time seeing me as your physiotherapist. Like, what exactly have you experienced as far as what those changes are for someone to recognize that right now you're in a state where we need to focus on maintenance here in the clinic, as opposed to just, continuously putting your body through so much physical trauma in practice? Any one of you can share exactly what that change looks like.
I think it obviously depends on like the circumstance and the person. But yeah, I think sometimes you might want to be seeing that person at that point a little bit more frequently. I kind of talk about it before, like the person is only seeing you for X amount of hours throughout the week. So what they're doing on their own matters a ton as well. So that's kind of where the communication thing comes in, as well as you want to make sure that they know exactly what they should be doing outside of the clinic as well. But yeah, like I said, if you need to kind of up the frequency of treatments in that particular week, sometimes that's a good option, so that you're able to kind of like modify things and see that person a little bit more frequently. Raj, anything to add to that?
Yeah, I'd actually go into a bit of an example probably. I think, Kenny, this might be where you're leading us a little bit. So a common publicly known scenario of that nature is Kevin Durant in the NBA Finals, not last finals, but 2 seasons ago. So two seasons ago, he suffered a calf strain, and there was a question mark about whether he would continue playing. This is the NBA Finals, this is the grand stage. So there are major external variables at play, major pressures. Personally, for him, I'm sure, as an athlete, defining his legacy, playing against LeBron James. So there's a reality of competitive, who's the greatest in the world right now. And his teammates are depending on him. His coaching staff are depending on him. So there was major external factors at play. Now, I don't know how it all went down and how the decision was made, but the decision was made to let him play. And as everybody knows, he ruptured his Achilles in that game that he did return to play. And you could see it on the video. All the replays show that muscle rippling up into his calf. And obviously he went down for the remainder of the season, and they lost that series, whether that would have made a difference or not, but they did lose that series. So that's a very, very public example. Your question alludes to what would we have done in that scenario. Now, in the ideal stage, the external variables are removed. So just from a tissue perspective, the athlete has an acute inflammatory injury. It's in the first 2 weeks that there's the biggest amount of swelling, and they need to rest. So they need time. The tissue just needs time. They should not be jumping. They should not be running. They need to get treatment. They need to get anti-inflammatory measures. They need to rest. After about 2 weeks, then we can start reloading that tissue to gradually cause adaptation and healing. So that muscle would recover in time with progressive remedial exercise, ultimately leading into sport-specific training and getting back on the court. So in the ideal world, that's how it would go. Now, in our experience, Kaitlin, the athletes that we treat, and there is a variety of how much the external factors are at play. So if it's a high school athlete where there's less external variables and it's early in the season, that's an easier conversation with athlete, parent, and coach. And we can say to them, our counsel is 2 weeks out of play with a return to play date goal of this. And most people will buy on. If there's other external factors, like if you're a professional, or if you have if it's a fight and there's a date set and you have a certain date you've got to get ready for, then those other external factors will be a variable we have to consider. So then it's just about us being honest. And we tell the athlete, this is kind of roughly what we can expect to achieve. You will have some limitations going into the fight, but I'll have you ready. And we'll be as close as we can, but you won't be at 100%. And then the athlete has to decide, is this for me or not? So ultimately it's their choice. It's information. We're counseling them. We're coaching them. We're guiding them. But we're also not deciding for them. In the end, athletes are athletes. They're going to decide for themselves. So there's a huge mental piece to that physiotherapy treatment regime.
I really respect and appreciate the honesty there, guys, because I can imagine that that's not easy to do, to just share with someone right off the bat that, listen, like, with that date in mind, I won't get you to 100%, but we will improve. And there's a little bit of tie-in, both of you mentioned, with strength and conditioning training. Getting you back into the gym, reloading, being aware of certain movements that, you need to get them back to, that are going to be in line with the movements that they do at a faster, more accelerated pace when they're being game ready and it's game day. Now, I'd love to share, because personally, I have witnessed the tie-in at Athletic Recovery Center at ARC, where Raj has set me up with himself as my physiotherapist and with an assigned strength and conditioning coach. And it was beautiful to bear witness the relationship both you and Nelson had in getting me prepared for competition. And I would just love for both of you guys to just boast and share why there's such a good relationship, and there needs to be a good relationship between a physiotherapist and a strength coach for an athlete, or just for anybody. Because I found, what I saw at Pivotal was it wasn't just athletes that you were doing this for. It was, hey, here's someone who would benefit strongly in working with a strength and conditioning coach. And now you and that coach are sitting down preparing for a structure. When you talk about like the phases you're going to put someone through, there's an actual roadmap set in place for both of these specialists to help that athlete out. And for me, I would almost argue that if the strength and conditioning coach wasn't there, I would have either had to just bite the bullet and be like, okay, well, this is going to help if I go find someone else. But the fact that that person was there in communication with you made things, in my opinion, go much faster and smoother for my process in getting back to pain-free. So I'd love for both of you to share exactly, the benefits, the advantages, the progression of a physiotherapist either being knowledgeable in that space themselves or ready to partner or delegate that material over to someone on their team to help out someone who needs that service.
You want me to start here?
Whoever would like to.
Yeah, I think the physiotherapy in general, I think it's kind of like moving more towards that, not only just recovery from an injury, but also just strength and conditioning as well. I think it's really important, like with athletes specifically, your goal is to get that athlete not only to like their pre-injury level, but to exceed that as well to prevent future injuries. So that's kind of where that strength and conditioning comes in. You're making sure that you're with that movement analysis or assessment that the physio is doing in the initial stages. You're making sure that you're finding all those imbalances, finding those weaknesses, and then targeting them. And strength and conditioning is obviously super important to kind of bring that person to the next level. And like I said, to exceed those pre-injury, that condition or level. So yeah, I think it's like super important. And places like Pivotal, for example, they have people working with both. So you're seeing the physio, you're also seeing a strength and conditioning coach, or the physiotherapist that you're seeing, like you said, Kenny, is knowledgeable on both sides of the spectrum. So yeah.
Mm-hmm.
I would add to that, Kenny, going back to some of the words that you used, I certainly wouldn't call it a delegation. If anything, I would call it a partnership. And I think that the movement analysis, will occur with both of those people. The S&C coach will inevitably see things through a certain lens, and the physio will see things through a different lens, but that is valuable. That is by definition better for the athlete. And then those two people need to talk, right? And make sure that they're planning things together. So, I would, for the audience, I would just paint out a bit of a spectrum here. There's a spectrum commonly, and Kaitlin alluded to this earlier, that physios are kind of known to be injury management people. And nowadays it's more than that. So instead of just thinking of the spectrum from injury to wellness, I would extend that spectrum to go from wellness to performance. So now we have a much more broad spectrum upon which humans enter. And some will enter with an injured shoulder, and they enter an injury and they go to wellness, and they're happy with just being well, and they'll move along. Some will enter at wellness. I'm already performing well. I've got a competition in 6 weeks. I want to be performing better. So they want to go to performance. And some will start at injury, thinking they want to get to wellness, and then realize this is really working. I'm more confident. I'm enjoying the process. I feel stronger when I'm lifting things over my head. I have an easier time getting up off the couch. I'm lifting my grandkids with ease over my head now with no injuries. I'm not sore the next day. So I want to get to that performance stage. And that performance stage will be different for each individual. So along the spectrum, different people will be valuable. Physios, S&C coaches, and others will be valuable. They might be dietitians, it might be counselors, it might be massage therapists or acupuncturists. Different, clinicians or practitioners will be helpful. But I think philosophically, people like Kaitlin and myself and you, we find value in motivating people, and we find intrinsic value in seeing them succeed and achieve their goals. So having them understand the spectrum, first of all, and then having them move along that spectrum in the appropriate amount of time is kind of the journey. That's the point.
Yeah, I really like the wellness to performance, because it allows someone to go above and beyond what they initially thought they were coming in for. It makes me recognize and respect that, okay, well, if you're not an athlete, let's get you to that stage where you requested to be pain-free, but now let's recognize that we could train you like an athlete now. It gets exciting at that point. When you could almost, there's that bar I find people set themselves to, and when you could exceed that person's expectations of what they thought they were capable of doing, it's magical to see. And I find that's why almost both of you could argue that you're in the space you're in, because even respectfully in what Kaitlin, you mentioned in your bio, is the fact that like you get to not only work with athletes, but you get to work with kids as young as 14 to as old as a senior who's 60 to 70 years old, who wants to go from that wellness to performance stage. And I'd love for both of you, if any one of you want to share a particular story of even a client that you have in mind, respecting their privacy, of course, but just sharing the dialogue of like you thinking back on where they were when they started and who or what they became after months, weeks, years of working with you or your team as a physiotherapist. I'd love for both of you to even share, if there's anyone in particular, like what you were able to see, who that person became and what they were capable of being able to do after spending that time with either one of you.
Mm-hmm.
Yeah, for sure. So a particular one that comes into mind kind of started off with someone came in with like an acute shoulder injury. Basically, they thought physio was just like, okay, I have an injury, I'm coming in, I'm going to get this treated, and then that's it, like I'm good to go kind of thing. So I basically worked with this individual, and we kind of got them out of that like acute inflammatory phase, that acute pain phase, started working on like building up that strength as well. And then just over time, that person kind of realized like the importance of physio and kind of like the information, at least, that I was able to provide them. And then just over time, like we've just kind of been building up that strength and targeting other areas as well. Everyone has like specific imbalances, like no one moves perfectly. So this person just kind of saw the value of physio in general, and now comes every single week for kind of that maintenance. So basically, like not everyone's kind of coming in every single week, but if someone sees the value, they're definitely more inclined to come and just learn about the body in general. So there's so much like knowledge. Everyone, whatever profession they're in, like they have an abundance of knowledge. So if you can share that knowledge with someone, they really appreciate that and are super receptive to whatever advice that you give. So like I said, it started off with like that acute phase, and now we're just working on like building up strength in all different parts of the body, working on any imbalance that we find, that kind of thing. So I think it's just kind of finding those areas of not only just pain, but like I said, imbalances, and just helping someone move better and move longer.
I really like that you mentioned that, because it clearly states, Kaitlin, how you accomplished what they originally came in for, and then all of a sudden, the goal changes, right? You sit down with them and they still want to do more, and you know that you can help them, and now it becomes an entirely different goal that you're capturing with your client. And I find in any space, this is just even outside of health and fitness, you have to ask yourself, well, why are they here again today, and what am I doing to make them 1% better? And I've even personally experienced moments where I had to humbly recognize that through conversation, what I originally thought was their goal has changed. And even in a capacity of recognizing that even an acute shoulder injury, if you're still focused on improving that, along the way, as the months progressed, certain things have changed in that person's life. Maybe there's a new injury that you have to take after. And it's only until you have that conversation. And I learned when you're servicing the client, it's arguably like they expect you to open the conversation. And I've had to notice through some of my clients that, like, and this is advice I got from one of my mentors in Good Life. He's like, you have to sit them down and you just have to ask, hey, I'm building the plan that we talked about 3-4 months ago. I still believe there's work that needs to be done. Does this still excite you? Is this still on your mind?
You might have seasonal change. You know, like in Edmonton, athletes are driven differently in the spring and summer than they are in the fall and winter. And their goals tend to be different, and what they find inspires them tends to be different. Some people love being outdoors in the winter months and some hate it. Certain sports are more in season in the winter versus the spring and summer. So it might even be like every 6 weeks or every 8 weeks having a conversation about what are your current goals today, and what are they going to look like in the next 8 to 12 weeks, which actually fits with most S&C phases of strength and conditioning. Those are somewhere between 6 and 12 week phases. So the phases and human motivation, they kind of align, right? So you certainly have to have regular conversations with them. The other thing I'd add to the conversation about like a special story. One athlete comes to mind, it's Denzel. So Denzel worked with us for a few seasons ago. He's a basketball player. And like Kaitlin said, initially came in with some acute stuff, some early stuff that we worked on and did a movement analysis and started improving those injuries. But along the way, he started working with both the sports psychology personnel and the S&C coaches. So he got kind of like what's working between the ears, fine-tuned and developed strategies on how to approach certain sports or approach certain coaching situations or approach certain self-motivation, which then drives the rest of the engine, right? And he also then built up the engine, right? His cardiovascular capacity, his strength capacity, his ability to lift and jump, all of those things improved through the course of the off-season, which is kind of like the ideal scene, right? Having an athlete come in open-minded, working through those processes and working through as a journey with, a journey with different personnel in play. And that makes that journey successful. So now that athlete is better off 8 weeks later than they were before.
There's two things I want to share about that, is the fact that what a hybrid and holistic model you just shared, Raj, where based off of that performance being elevated, there was a sports psychologist involved, there's physiotherapists, there's strength and conditioning coach. Like that is in its own clear definition of what it feels like to have a team under your back. And I'm sure Denzel was able to reap and sow the benefits of having all members on the same page. And in a sense, second to that, with talking about goals, I found that what both of you were so clear about is timeline. It's something that you recognize, hey, well, what do you want to accomplish in 3 to 6 weeks? That is something that I notice is really important to address. Now, I know there's so many different ways of trying to get as much information as you can from someone. I know trust is a big thing, right? Like that goal might just sound more in depth after a week or a month of your patient or client visiting you. I'm just wondering some strategies that you guys can maybe bring up for any health professional out there who is trying to find better ways of asking what someone's goal is. And this is actually very, for me, I'm very curious to know, because I always look at it like, okay, well, what's their need? What's their goal? And then what's their timeline? Now, here's the thing, guys. I'm very curious about this personally, right? On my end, I know based off of how we ask certain things, it will allow for us to get certain information. And from an approach of figuring out one's needs to their goal, and what both of you very much so talked about, the importance of timeline. Now, to make sure that other health professionals out there, or anyone out there, determining what one's goal is, especially their clients, what are some things you guys do and how you say it brings the most amount of information you need to know from your client. Guide me through in that pre-assessment consultation piece of the onboarding process. What do you ask? How do you ask to get the most amount of information?
Yeah, I'd start with a model. Like in my brain, physiotherapists are taught to use a holistic approach. We call it a biopsychosocial model. So we incorporate the human's biology, the human psychology, and their social situation. What that means is if you came in with a shoulder injury, I'm going to ask you about your shoulder. Of course, that's the biology piece. And of course, that's what most people probably think of when they hear the word physio, is addressing my shoulder. The psychology piece, I'd ask you questions about what your goals are. I just ask you straight up, what would you define as a successful goal with your physiotherapy outcome? And then of course that might lead us down a certain path. So I might say, what inspires you? If you say, I want to lift overhead, I would say, why? Do you just want to lift overhead? Do you have a competition coming up? Do you lift your grandkids overhead? Do you play sports that require overhead motion? Like why? What inspires you about overhead motion? And then socially speaking, I'd ask you, are you currently missing time from sport? Are you missing your teammates? Are you still at practices but doing modified work? Like what's happening in your social situation specific to sport? Now, of course, that might also be what else is going on in your life. Are you working from home right now because of COVID? Are you lonely? Are you isolated? Are you looking for outlets that are physical or otherwise? So I want to know all of that information as best I can, and as much as you're willing to share. And with all of that information, then we develop a plan that fits your true goal, which is more than just your biology. Like you don't just want to get your shoulder better. You want to get your shoulder better because of something. So what's the why? I want to define the why.
There's a little element of figuring out what their intrinsic motivation is there.
Totally, yeah. What's your why? Yeah, Kaitlin, what do you think? How do you approach these question asking kind of first day?
For sure. I think that model is so important, kind of touching on all different aspects of why someone wants to recover. So what Raj brought up there is so important. And I think it's not only that initial assessment where you're finding all of this out, but it's an ongoing process. Every time someone comes in, things are changing in their life. You want to just kind of have that conversation every single time and know exactly not only how that shoulder is, for example, but how their life is. Is anything changing? Is anything maybe affecting the recovery process? So yeah, it's something, like I said, it's not just that initial assessment, it's an ongoing assessment every time. And the most important thing is just, like Raj said, someone's why. Why do they want to fix their shoulder? Why do they want to fix their knee? How is it impacting their life? A lot of times it's not just physically, but also psychologically as well. So there's so many different factors. And it's just kind of making sure that it's more of like a holistic approach to recovery, right? And you also want to, those conversations that you have with someone, you might find that they could benefit from something in addition to just physiotherapy. So you're trying to help this person as much as you can, and maybe you can't do everything for them. So maybe you're referring to a psychologist, maybe you're referring to a dietitian, a massage therapist. So it's really kind of learning about that person and then just doing whatever you can to get them to where they need to be.
I'm really touched by what both you said, because it shows how much you guys care in terms of the more I know, the better. You know, you're not holding back. You know, with more of what they can provide back to the, you know, the biopsychosocial element, and then tying into the golden nugget in which Kaitlin mentioned is ongoing assessment. There's 2 questions I ask that relate to that to my clients every single time they come in. And I still have to remind myself to ask it. And I'll let you know why. And I can't imagine if, well, I bet both of you have been in this position where you ask someone, okay, well, how's your body feeling today? Right? Like, where are you at? How sore is that shoulder? Anything else we need to be aware of? Second thing is, how are you doing today? Out of 10. Where are you at? How are you feeling? And even just by asking that, you get a gauge of seeing how prepped and ready they are. They naturally, I notice clients become very honest with you. You become a big rock in their life, and they're not going to lie to you. They're not going to say good like one would say just in passing to another person. Now, why I say this is because that reminds you of that ongoing assessment piece, Kaitlin, where you kind of see where they're at today. Maybe, for me as a trainer, I was ready to put them through their deadlift 1 rep max test. You know, we're 8 weeks. Let's see where you're at. If they're a 6 out of 10, and I'm noticing they had a long week and they can't wait for Friday to come around the corner to rest after a long week, okay, well, maybe today we're not going to do the 1 rep max. I have to think quick on my feet to be like, okay, well, let's change things up. Let's, you know, degress rather, and put them through something that would be more of a fit. Because I did learn from experience where I would ignore that and I'd go, oh, well, it's up to me to make them feel better. And I would get them to do their, let's just say their 1 rep max test that day. I try to get them all pumped up. And then from the social and psycho piece, they're nowhere near where I thought and they thought they could be. Yep. And now not only did I fail to recognize that and have a plan B, I feel like I made that client feel less worthy. Sure. And that feeling sucks. Sure. It sucks, but it's just knowing and being aware of where they're at today. Yeah. You know?
Yeah, they also risk injury.
Oh, right? Big time.
If you're approaching it like without understanding, let's call that 6 out of 10, if you're going into the 1RM, there's a potential injury there. So some simple questions that we ask with some of those athletes. I'm sure, Kaitlin, you have a few in your toolbox as well. I ask, how did you sleep last night? And that might mean how many hours, what was the quality of your sleep, etc. Have you eaten today? If so, what did you have? And then also, what's your energy level? Which is kind of like what you're asking, like, how's your day going, right? So if they say, I slept 8 hours, it was beautiful, I had an amazing breakfast of oatmeal, peanut butter, and dates,
they're ready.
I had a banana on the way here, I'm feeling like a 9.5 out of 10, then you go for that 1RM that day, right? And if they say the opposite, I just honestly tell them, okay, you know, today you're kind of operating with your max tank at about 60%. So I want you to give me 57. And we're going to push you to 57 today. And that's about, you know, that's a realistic stimulus for you today in order to get a healthy adaptation out of it. And that you won't get injured. And that then 6 weeks later, we're still operating forward thinking. We're not falling behind because of setbacks. So you minimize setbacks along the way.
I like
that. Look for compounding gains.
And that leads me to a big conversation I want us to have around the one thing, no matter where you're at, 1 out of 10, 2 out of 10, 3 out of 10, wherever you're at, how much sleep you had last night, the food, all of that. I love it. Super important. But it's the one thing I'm sure all of us can agree on that you certainly should not skip out on in a workout-based activity. And that is the warm-up. This is something that only until I was very recently educated on, I will give you an idea of where I fail to recognize it serves more than just the purpose of sweating. I'd go in, even as a trainer when I taught kickboxing classes, with the assumption of, let's take 1/4 of the hour I have with my group, with my client, let's get them warm. And even like literally warm, you know, let's get them moving. A lot of mobility work, moving around. Let's do, at the very least, I recognized something closely similar to what we're going to work on today. I knew that's Good. That checked off the boxes.
Sure.
Now, where for me as a trainer, and even just as a person who didn't understand, because I think anyone, whether they're with a trainer or not, should do a warm-up in this capacity, is mobilize and stabilize. Do a little bit of foam rolling, myofascial release, do a little biphasic stretching, right? Be able to move yourself in a position where you're stretching not for 20 minutes on end, but for that particular muscle group that you are going to be priming for a minute to a minute and a half, whatever it is. Now, something that I'm glad Raj shared with us is Dr. John Russon's 6-phase warm-up, which is something that I actually learned in my pain-free performance certification. And it recommends, it is drilling people's heads on the fact that you need to warm up in this way, and it will only take 12 minutes. Now, we could go a little bit in depth on what those 6 phases look like, sure. I'm sure we'll share the article and everyone can learn exactly how to effectively warm up. I more so want to add to that, and I'm curious about, the importance around warm up from your guys' opinions, from how you set up the warm up, and how just overall your opinion surrounding the importance of it, and recognizing that it might just be the exact same warm up, and that's okay, depending on what you're doing that day, or it might be very different. It might have to be modified slightly for some people.
Yeah, for sure. I think that two of the most important things when it comes to warm up are that it's specific. So it's specific to what you're doing that day. So if you're doing like a deadlift day, your warm up is specifically tailored to those movements that you're going to be doing with a deadlift. And another thing too is it's individualized. So it's individualized for the person. So say someone has a specific mobility issue or soft tissue restriction, their warm-up is going to be specific to that. So those are kind of the two things that I'll focus on with warm-up is individualized and specific. And then we can kind of get into like those 6 phases of that warm-up as well. But Raj, anything before we get into that, anything that you have to add?
No, I agree with you. Looking at the individual in front of you and whatever they present with in terms of how they move has to be kept in mind. And I think, I won't steal your thunder here, but I think you're going to lead into the 6 phases. So go for it, Kaitlin.
Get your popcorn ready, folks. This is it.
Okay, so the first 2, I would say, kind of go hand in hand. So a lot of people ask like about foam rolling. I think foam rolling is something that definitely can be added into a warm-up. Again, you don't want to be like going to town with it, but spend a couple minutes, make sure that it's very specific and focused. So say you have specific trigger points in the quads, for example, you're just going to spend a little bit of time on that. So it's very isolated to areas of like increased tension. And then, as you said, Kenny, you have the biphasic stretching as well. So again, and that's not taking up too much time, but you're basically focusing on 30 to 45 seconds oscillating back and forth. So that's just very kind of like small movements, a little bit more like dynamic. And then once you get to that end range, you're holding that for about 15 seconds. So basically with these 2, you're kind of targeting that parasympathetic response in the nervous system. So that's that rest and recover. So basically trying to get those areas like released and warm. Basically, those are very targeted, like I said. Then you can get into corrective exercises. So again, those are very like focused on the individual. And in that article that we kind of went through there, it talks about the 3 S's. So that kind of comes down to stability, strengthening, and smoothness of movement. And then we get into the specific muscle patterning and activation. So again, before I said that it's also specific to what you're doing that day. So say you're doing like a lower body day, you're activating certain muscles, and those are usually certain muscles that you specifically may need to focus on more so than maybe someone else. So say you have like a bit of like a glute weakness, hip stabilizer weakness, you're focusing maybe on some band work in this component of the warm-up. Again, you're not spending like a crazy amount of time on this. So 2 to 3 sets, 5 to 10 reps kind of thing here. And then you're getting into more of like the foundational movements. So again, this is also very specific to what you're doing. Any like big movement patterns that you're doing, you're focusing on here. So say you're doing a squat, you do something like just body weight squats. So you're basically warming up into that movement that you are going to be focusing on. So that was 5. And then lastly, you really want to focus on getting the central nervous system warmed up. So there's also the ramp principle. So this also goes along with that. So you're basically, the P in ramp is potentiate. So you're focusing on kind of like the explosiveness and power. So really warming up that nervous system as much as possible so that you are ready for that competition or for that lift. So this totally depends on what you're doing as well. Like say you're going to play like a soccer game, that's going to be different than if you are doing, let's say like a bench press that day. So again, all of this is very specific to what you're doing in that warm up. In that workout. And it's also specific to the individual as well. So everyone's going to be moving a little bit differently. Everyone's going to have different focuses as well.
Wow, that was textbook. I really appreciate you sharing that. That's like right bang on, Kaitlin. And it's really amazing to know that with those 6 phases, ideally it should be 12 minutes, give or take. And just recognizing that each phase is like 2 to 3 minutes. Pop, 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 pop. You get one done right after the other. And the 6th phase, I'll be honest with you guys, is my favorite phase.
I'm not surprised. That's a high energy phase.
It is.
Right?
I find just naturally so. It's kind of funny because I have to share this. From when I was a client to now a trainer, I see certain things Nelson, my strength and conditioning coach at ARC, did. And I know why now to a better degree, because that 6th phase is you getting that neuromuscular adaptation primed and ready. It's that mind and body connection.
That's right.
As Kaitlin was mentioning, where you're tapping into that central nervous system, and what was originally your parasympathetic is now shifting into sympathetic.
You're getting your mind right and your body right.
And the ways in which it's done is beautiful. Like the one way, Kaitlin, is, let's just say, this is one of my favorite ones. 5 jumping jacks.
Yeah.
Quick. Like pop, 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 pop. And then immediately, med ball, right in your hand. You slam it to the ground. Slam it to the ground. Like you're doing very primal instinctive,
movements.
rushed things to do. Sure. But, oh man, like just to see someone finish off with that, shift things over. And for me, I've experienced it because this is how I warm up now. But when I ask my clients now, I'm like, hey, how's the warm up? How do you feel? And they're just like, oh, I'm ready. Like you see it in their eyes. Like they just want to get that heavy lift out of the way right away, which is naturally what you're trying to prepare them for. You know, and what I love is through experiencing this and you sharing it, Kaitlin, is not only are you moving someone more towards the progression of pain-free, you're not trying to exhaust them in the first 15 minutes when you're with them. Sure. And that's why I'm so glad you mentioned it, Kaitlin, because I went from feeling like, oh, I need someone after the warm-up to like crawl for their water, because we got them sweating, to, hey, you broke a sweat, you're a little bit warm now, but you're ready. Yeah. You're ready for now the toughest part of the workout. We're going to start with that.
Yeah, that's right. It also is a time for, like, if you take 12 minutes as our example, it's a 12-minute transition from the other part of their day, whatever was going on and will go on, into the focused task for their time with you or their time with us. So there's a mental piece to that. Like, put it at the door. Some are good, some are not good at that. But that 12 minutes allows you to make the transition. So now you're ready and focused for your task at hand.
It really is. I couldn't agree more. For any of one of your favorite, let's say, ways of it being an athlete, or it being, this is for both of you, a particular sports player, a particular, just to say, type of movement, a chest day, a leg day. Guide us through what those 6 phases look like for a particular person in sport or particular part of the body for anyone listening to this, because we've got the general idea of how the phases should look. Now it'd be great to just go in depth with, okay, what exactly are we going to be doing with each particular phase? I think it'd be really nice to share from any one of your guys' perspectives.
Kaitlin, do you have one off the top of your head? If not, I'm happy to go.
Let's go with a squat.
Beauty.
Do you want me to lead?
You want me to start off?
Sure. Go for it.
So for everyone out there who's listening to this today and it's leg day, or it's not leg day, you better hope today's leg day. So let's hear it.
So yeah, again, like obviously it depends on the person. It depends on like what specifically they have going on. But let's just say they're about to do a squat. Quads are pretty sore, lots of trigger points in the quads. They'll start off that targeted soft tissue, like foam roll phase. So the first phase, maybe getting into the quads for a minute or two. And then stretching. So they would do, again, that biphasic stretching for the quads as well. So you're kind of like targeting those same muscles that are problematic or tight or trigger points. And then, Raj, do you want to do the next 2?
Sure. The next 2 were, after the biphasic stretching, we're going into stability and activation. Okay, so stability for the quads and into going into a squat pattern, you need to be able to maintain an upright trunk, so a tight thoracic spine with a lengthened posture in mind, while maintaining an abdominal engagement. So the rib cage is being drawn down towards the pelvis at the same time. All of that has to be done while flexing the hips and dropping into what we call the hole of the squat. So what that would look like is maybe some extensions of your thoracic spine while dropping down into a squat pattern. One thing I like to do is I like to walk over to the rig, wrap my hands around the rig itself, and then drop my butt down to the floor. So I'm dropping into hip flexion, ankles are dorsiflexed, and in that position I'm going to do 2 things. Number 1, I'm going to work on extending my thoracic spine and doing reps of that, maybe 5 or 6 reps, just getting the T-spine primed while in that position. And then number 2, I'm going to work on hip external rotation while corkscrewing through the floor, because that's one of the things that you need to focus on in the heavier part of the squat. So I would do that. I would drop out of that warm-up and then drop into glute band bridges. So band around the knees, lie on your back, squeezing the buttocks, squeezing your abdominal muscles, lifting the butt up into the air, and creating tension in the band that is now around your knees at the same time. I do about 10 or 12 reps of that. I've got my glutes fired up, hamstrings fired up, core fired up, T-spine nice and extended, and then going into my movement of the day.
Wow. I love that. That puts us into stage 5.
Stage 5. Kaitlin?
5. Okay, so next one would be you're getting into like the foundational movement. So this would just be your squats. So if you're doing squats, you're focusing on squats body weight. With this, form is so important. So obviously you have no weight, so your squat should look perfect. So you're going into that depth. You're focusing on, like Raj said, your T-spine extension. Squat should look perfect. For this, you're doing like a few sets, 5 to 10. You can also, with this, it kind of will translate into like your warm-up sets as well, super lightweight, just focusing on those foundational movements. And then next would be you're priming that central nervous system, so the 6th phase. So with this, you're getting that heart rate up. For squats, I would say something like jumps, so maybe box jumps, broad jumps. So anything, squats is obviously bilateral movement, so your jumps should kind of be bilateral as well to match that. And yeah.
That is awesome, guys. Thank you. I genuinely appreciate both of you going in depth with that, because that is such tangible information that I find our listeners are going to be able to take away and apply into their training, right? For this next part of the conversation, guys, we're coming close to concluding what is a very knowledgeable episode from both of you being so educated in this conversation. And this topic is really, from your perspectives, knowing that in the space we're all in health and fitness, I'd argue that all three of us are in it and love it because you're constantly learning. It's never ending with scientific-based evidence, with new ways of priming one's body and making them go more in the direction of being pain-free. There's just so many new ways of doing it. And we talked a lot about a hybrid, holistic, hub and spoke type model of how physiotherapists are now partnering up with other health professionals, are working together, collaborating on what they all specialize in to help someone progress into performance after wellness, with what Raj mentioned earlier. Two questions here. Where do you know the journey of a physiotherapist is going? What route and what direction is that career choice going? And where do you want it to go? Let's say it's 2040 or 20 years from now. Coronavirus is done. The world is flourishing. You could get, there's new technological advancements in place. It's a perfect world of where you want a physiotherapist position to look like. Guide us, both of you, through, what for sure is going to be in the works of this role and where you want it to go.
Sure. I think that one of the things that in terms of trends that we've seen in what I would call the health and fitness space or the orthopedic space over the last decade at least, is there seems to be a merging of the worlds. Physiotherapists, chiropractors, massage therapists, S&C coaches, osteopaths, kinesiologists. I'm sure I've missed a few in that list. But these different disciplines or schools of training are kind of looking at the human body as a system, which it is. They're kind of looking at the human body as a complex interplay of different neurological, muscular, joint systems working together, which it is. And then as a result, people are getting better service. The public is getting a better service as a result of that. No longer is, like, if you come to a physio clinic and all you get is ultrasound, that's pretty sketchy treatment, right? That's all very, very old school.
It's not fair.
Yeah, and it isn't a globally successful pathway. Now, once in a while, maybe use ultrasound, sure, but if that's all you're getting, there's a question mark there. The same thing with chiropractors. If all you're getting is a quick lock and pop for 30 seconds, then out the door, I mean, that is the knock on some practitioners. And that's also, I would call that not so common these days. In the last decade, the practitioners that we collaborate with, there seems to be a much more thorough evaluation and thorough treatment delivery. So going back to your question, I think that not only in physio, but in orthopedics in general and health and fitness in general, we're starting to look at the human body as a mix of different systems and working together in those systems. So we need to get good at identifying which system is the bottleneck in a certain day, which system is the bottleneck in a certain period of time, and then intervene with that bottleneck at that time while maintaining performance of the other areas, the other systems. So maintenance and proactive behavior are key. And then identification of where the bottlenecks lie are also a key. From there, we use our toolbox. Then we show up with our toolbox. We do needling, manipulation, manual therapy, exercise, cupping, contrast paths, etc. But all of those tools need to be used with that preliminary strategy and assessment in mind. That's already happening. That's already been happening for the last decade. And I think that'll happen more and more over time. Kaitlin, maybe what do you think about that? And then also, do you know of any technologies that maybe are coming into vogue in the next little while that maybe our audience wants to look into?
Yeah, for sure. So I think in the future, Currently, right now, I think a lot of people are still, they have that perception of physiotherapy or chiropractic, pretty much any of those professions as like you have to be injured. So we kind of talked about this previously, but I think it's going to lean more towards in the future, like just optimal human performance, and people coming in to just move better and be better. So I think it's going to kind of switch more towards like that preventative, and it is happening now, but I think it's going to happen more and more in the future, is just more of like that wellness side, people coming in for like maintenance to prevent future injuries. And like I said previously, people to move better and move longer. So I think that that's where I can kind of see things going. As far as technology too, Raj, you guys have the, do you want to touch on the new technology that you guys have at Pivotal?
Sure. Yeah, I'll touch on a few actually. So let's go chronologically here. So already today we have technology. There's wearable devices. People are wearing Apple Watches and Garmin's and Whoop straps, and all of these different wearable devices give people the chance to look at their own metrics, to start playing with those metrics and start improving their performance themselves, self-monitoring, but also report those metrics to people on their team. They could report those metrics to you. And they could say, hey, Kenny, I had 3 good days, bro. Like, what are we going to do today? Or I had like a shitty couple days. Like, I really need to recover, need to work on my sleep and my stress levels and my eating habits. And so the wearable devices aren't the be-all and end-all, but they are a very valuable tool to help people improve their performance in whatever respect that might be. So that's one approach. We have what we call the PNOE. It's a metabolic cart at ARC, and we use it to evaluate Vo2 Max Testing. So what's the person's aerobic capacity? That aerobic capacity can also be drilled down into which phases of training that athlete tends to be either really good at or needs to improve upon. From that information, we can then develop a program of training and a phase, maybe 6 weeks long or 8 weeks long, and work on essentially improving what we call their bottlenecks in their performance. And then a retest could take place at 6 to 8 weeks after that. So that's available essentially now. Now, if you ask the question about 2040, that's a totally different question.
It's a different ballgame then.
So if we go 20 years down the road, now we're all speculating, right? And myself included. But if we're speculating, I think we're going to have chips implanted in us. I think like the wearable device will no longer be wearable. It'll exist in the human body somewhere. I think that those glasses will no longer exist. I think that your eyes will just be technologically solved. Your vision will be perfect somehow. So I don't know, but we're getting into a very interesting and potentially kind of scary space where human performance can be improved to the nth degree. This could turn into a sci-fi conversation, so I won't go there. I won't go super far. But I think like, if we're talking 2040, and if you look at the trajectory of science over the last 20 years, 20 years from now, it's going to be even more exponential. So I don't know the answer, but I think we're going into some interesting times, and hopefully we're around to see all that.
Well, if we're going to go there, I mean, we're talking 2040, brand new franchise, Pivotal, opened up in Mars, one-way ticket.
Sure, that's right.
No, I appreciate both of you guys sharing that. And it reminds me something that we even spoke about with business owners in our first season, when the focus was very much so focusing on business owners and entrepreneurs. And it just goes back to the point we always love to make with guests, where it's like collaboration over competition. Both of you very much so mentioned that there's going to be others helping out your client, and you're willing to work on that together. And then on the other end, I love that even Kaitlin brought this up when we all first started talking about what this episode will look and feel like. When Kaitlin, you shared this, and it really resonated with me. We focus so much on, we got to get our car for its oil change. We got to make sure we're doing every preventative measure to keep our car running seasonally, especially here in Edmonton.
Sure.
As Raj mentioned earlier,
it's like tires.
Oh, it feels like we're living in two different cities when the snow hits, right? So we do all of that for our vehicles. Why are we not doing that for our body? And I love that both of you mentioned it's almost like I'd love for it to be more of a mandatory prerequisite for any athlete, for any human being to get prescribed in seeing a physiotherapist. And thankfully, for the majority of people in the workforce, they have benefits that allow them to still see a physiotherapist periodically. And that's why for anyone listening to this, whether you're as close to the spectrum of being pain-free as you are, or you do need some help, I hope listeners can gather a little bit of more motivation after listening to both of you speak about the importance of preventative cautionary therapy, right? To help your body be primed and move a certain way, no matter what stage you're at in life. So it's really beautiful to hear both of you be, very open to that dialogue of collaborating with others and recognizing that a physiotherapist is just as important as your car mechanic. I'd like to come to a conclusion, guys, as we wrap up our conversation, in recognizing that both of you are specialists in your field, and fortunately so in opposite ends of the country. So Kaitlin, I want to thank you for obviously there's going to be some new listeners interested in hearing you speak from the Greater Toronto area, and it's awesome to know that you're willing to be on. I'd like both of you to share, for our listeners in Toronto, for our listeners in Edmonton and in Alberta, where can they potentially be serviced through physio by both of you? And how can our guests connect with you if they're interested and if you allow for that to happen?
Of course. Kaitlin, you want to go first?
Yeah, for sure. So I am in Toronto, as Kenny said. I'm working out of 2 clinics here. So one being Live Active Sport Medicine and the other being Athos. If you guys want, you can reach out to me on Instagram. So my Instagram is Kaitlin.physio. So KAITLIN.physio. I'd be happy to connect with anyone through that. And yeah.
Which I highly recommend folks check out your Instagram wherever they are in the world, because you provide tremendous amount of value on there as far as movements and the science behind it. So thank you, Kaitlin.
Caitlin's content on Instagram puts mine to shame. So if you're going to go on Instagram, check out Caitlin's before you check out mine. For those of you that are in Edmonton or that area, you can find me at Pivotal Physiotherapy, or you can find me at ARC by Pivotal Physiotherapy inside of Evolve Strength downtown. I hope that we can put those communication details in the podcast eventually somewhere in the link or something.
Absolutely.
But my Instagram handle is at Raju Dillon. That's RAJUDHILLON. Or you can find us on at Pivotal Physio or at arc_pivotal. And all of those I think will be in the link as well. So reach out if you have questions, if you want to know how to improve your body's movement or your performance, if you want to simply know how to design a warm-up so that you can prevent injury and be proactive, reach out to Kaitlin or reach out to myself and we'll be happy to help you.
Thank you, guys. One of my favorite questions to ask every single one of our guests. Raj is probably very prepared for this one. Kaitlin, this might, come at you as a surprise, and I'd love to hear what you have to say. And we could start with Raj and then carry it over. Any single person we bring on to the Second Floor podcast, we believe indoctrinates a type of mindset where they always feel like they're elevating in their life, in their health, in their business, and whatever it is they're doing. They're always thinking one step ahead. And that's why naturally, so when I ask and talk about the future, I could just tell about how excited both of you get in the plans of where your field is going. So from your own perspective, from giving tangible advice to someone out there, what do you believe it takes to take it to the next level? To indoctrinate the mindset of being on the second floor. What exactly does that look and feel like?
Yeah, I would make it really simple for the audience. The 2 biggest predictors of success are confidence and consistency. So that's my answer, is if you want to improve your physical well-being, if you want to improve how you move, if you want to improve your performance, proceed with confidence, which might mean you need a little bit of help or a little bit of information or some counsel. We can give you those things, but be confident. And then secondly, proceed with consistency. And that means you cannot improve everything in 1 week. It might take a little bit longer, so get some counsel on how long it should take. That way you have realistic expectations. But be consistent and put in the time. There will be ups and downs, things in life will come up, and there will be ebbs and flows. But overall, if you're confident and consistent, the things will get better, and your ability to move and your performance will also improve.
I love that.
Are we getting
Thank you,
Caitlin
Raj.
back on the call?
Caitlin is.
Oh, she's back.
We worked that out. No problem.
Good job.
That was behind the scenes. A quick message. I was like, Caitlin, make sure you hop back on while Raj talks. Yeah, we're running course. So, Caitlin, that was Raj finishing up with his answer. Talking about the value of being consistent in whatever it is you're pursuing, and much more. For yourself, what exactly would be your tangible advice for elevating to the next level in one's pursuit?
It's important to find out what motivates you. So those motivational factors are huge. And then another thing is just don't be afraid to ask for help, to ask for advice. I think a lot of times people kind of let their ego get in the way, but it's important to know that I said this previously, but everyone kind of has an abundance of knowledge to share. So ask questions. Don't be afraid to ask as many questions as possible. So I think that's the most important thing is just be willing to learn more and know that there's so much more knowledge out there that can be shared. So yeah.
I love it. Yeah, be curious, right? Yeah. At the end of the day, guys, I want to take the time to acknowledge both of you for, really being such incredible representatives in the space that both of you are in. With Caitlin going the extra mile to be present and be vulnerable on social media, to showcase what you're doing with clients and to give just that much more knowledge to others, and to take time out of your day to be here and sit with us, as well as Raj, recently achieving through YEG Fitness one of the nominations of being one of the most top physiotherapists in our city, but also the top physiotherapist clinic. So to really bring you both here to share this type of knowledge with our guests is huge. And even for myself to have a front row seat and learn from both of you, I extremely appreciate. So thank you so much for your guys' time. And I just want to share with our guests that if you found value in this episode, please feel free to share it, review, and give us a review on iTunes podcasts. We are in as many platforms as possible at this point. You could catch us on Spotify, on Apple Podcasts, on several other audio platforms, YouTube, and of course now TELUS Optic TV. So I'm really excited. There's going to be a lot of people that will gain a lot of clarity and more of a deeper understanding of what physical and mental progression looks and feels like.
Thank you, guys. That's a wrap.
No problem. Thank you, guys. That's a wrap.
Thanks, Caitlin.